Hello, this is the American Medical Association's Moving Medicine video and podcast. Today, I'm joined by Dr. James Madera, the AMA's CEO in Chicago, to discuss the AMA's 175th anniversary and its recovery plan for America's physicians. I'm Todd Unger, AMA's Chief Experience Officer in Chicago. Dr. Madera, 175 years, that is a pretty impressive accomplishment for any company or any organization. But it's a particularly proud moment for the AMA. Why is that the case?
Well, let me just use the words that you used, impressive for any company, and put this in perspective. The Dow Jones Industrial Index is of all the major companies, the largest companies aggregated for the largest impact in the various fields. The Dow Jones started 50 years after the AMA. Not a single company that was on the original Dow Jones is currently on the Dow Jones. So by that measure, the remarkable staying power that the AMA is really punched out. And we started 50 years before that. And a lot has happened in that 175 years. In one area, technology, we're just in a very different place right now. Anesthesia had just been discovered as we were being formed. There were no antibiotics for another approximate 75 years. No mechanical things like robotic surgery, obviously. So the field has markedly changed, but some things have remained kind of constant. In 1847, the relationship between a physician and a patient was really important. And the same holds true today. Medicine is a really personal, deeply personal issue. And throughout this remarkable journey of 175 years, we've remained the strong voice for American physicians.
Well, it's very interesting to, you think about all of that transformation that's occurred over what is approaching 200 years. When you think about why the AMA was founded in the first place, are those core principles still relevant today?
I think the key word for our founding was rampant quackery that existed in our country at the time. And, medicine in the United States in the mid-1800s was behind that in Germany, England, Italy, France. And so we had a lot of work to do to catch up. There was no certification, no educational standards. So the first things that the AMA did, the first two products, were standards for medical education. And also the Code of Medical Ethics to get this field into a better position. Now, that has served us really well because we look now 175 years later, the last 2 years during the pandemic, there was a lot of quackery. There were drugs that were promoted that had no effect and in some instances were dangerous. There was, sort of a lack of a strong voice if the AMA had been absent to really think about medical education in a really rigorous way. And how do you apply that at a time of a pandemic? And how do you deal with the misinformation simultaneously? So those core principles from 1847 have been used throughout the history of the AMA, and were particularly important during the recent pandemic.
Yeah, it's amazing to see how a mission can stay relevant, stand the test of time, adapt, as you say, to new challenges as they come. How, when you think about the mission of this organization, how does that continue to drive the work and adapt to where we are?
Yeah, I'll tell you, the mission to promote the art and science of medicine and the betterment of public health is why I'm here. That mission was really appealing to me. And we can think of that mission in two parts, promote the art and science of medicine. And the goal is really, in thinking through that, is how do we take the $4 trillion that we spend on healthcare in this country, and then in the context of 800,000 physicians, 330 million Americans, 4 million nurses, 5,500 hospitals. How do we as physician leaders deploy all that for the best health outcomes of our population? So a really broad-based thought when you think in the beginning of our mission statement. And then, the betterment of public health is also incredibly important. And we've, throughout our history, have voiced strong statements against dangerous and unproved therapies. We've promoted childhood vaccines when they were created. We argued strongly and successfully for requirements of seat belts in automobiles, argued successfully against the tobacco industry, all of which were incredible to improving public health in this country. The other thing that stands out is a newborn in 1847 had a expected lifetime of under 40 years old. And now ours, although variable among populations because of problems with health equity, overall, we're about twice that. We're about almost 80 years old. And that's a remarkable achievement in 175 years.
Now, when you think about looking forward, especially when circumstances like life expectancy have changed and technology, all these things you outlined earlier, when you think about kind of the work going forward, how do you translate that mission into the challenges that the future offers now?
Well, since around 2012, we've had a long-term strategic plan, framework for a long-term strategic plan that we revisit every year. We have a sort of a rolling 5-year thinking about this plan, but also think beyond that. Where will we be in a quarter of a century? And what we've done based on our House of Delegates policies are select things that relate to a lot of policies that you could characterize as being pre-competitive. And what I mean by that is any health system that exists in 2047, or, mid-century, if you don't have these three things somewhat figured out, it's not going to go very well. So it's needed for whatever health system we have. And those things are to remove the obstacles that interfere with physician-patient interactions, to drive the future of medicine through enhancing medical education, educating for the 21st century, not the 20th century. And recognizing that in the last 50 years, the disease burden has shifted in our country from episodic disease to chronic disease. And that chronic disease is now 85–90% of that $4 trillion spend. And we get more and more chronic disease. And this pandemic is producing yet another origin of chronic disease. So unless we get these three things, make progress in these three areas, no matter what health system we have, it will suffer due to the absence of progress in these three things. And then we've also identified accelerators that touch all three. One of those is the advocacy that we do to memorialize the progress that we make through regulation or legislation. Another is the innovation that's done in all these areas. And the third and most recent is health equity. We know that are great inequities in our society, and the pandemic really punched those out in a really significant way. And I would say almost an embarrassing way for a country as rich as we are. So through all these things, we are the powerful ally to physicians in their care of their patients.
Well, the past couple of years has certainly thrown us quite a challenge in doing that, taken a huge toll on this nation, and in particular on this nation's physicians. There was an article recently published by the Mayo Clinic that told us that 1 in 5 physicians plans to leave the profession within the next 2 years, and a lot more plan to reduce the hours they work. We've seen this headlines across the country about the great resignation for non-physicians, but what are we looking at here in medicine in particular?
Yeah, well, I would pause just to go back to the beginning of the pandemic and what was the state then. We know through work that has been done in our professional satisfaction unit that work with RAND, multi-market work, demonstrated that, what satisfies physicians is face time with patients, sort of 1, 2, and 3. And the dissatisfiers are all the things that get in the way of that. And then we did a time motion study, multiple markets, and found that for almost every hour that a physician is face to face with a patient, there are 2 hours of administrative load. So that's where we were at the beginning of the pandemic. That kind of feature that creates burnout. And then we layer the pandemic on top of that in the beginning. And it's just been a real challenge for physicians in this country. And you think of them at various levels. If you're a medical student, you've had 2 years of a disrupted training in a 4-year program. If you're a resident, you may have imagined becoming an expert in gastrointestinal surgery, but what you're now expert in is COVIDology. And if you're a physician in practice, practices were severely disrupted. So what we know about physicians is that's not a resilience issue. In fact, physicians are more resilient than the remainder of the non-physician population. But it's the dysfunction that surrounds the physician that brings this toll. And then adding to that toll, I've already alluded to it, is the disease burden that is asymmetrically carried by the historically marginalized populations. It's interesting that Johns Hopkins did an international study of what country would best handle a pandemic. And that happened to be published at the end of 2019, just before the pandemic, over 100 countries. The United States was number 1. And yet when the pandemic hit, we were at the bottom in terms of report performance. So if we look at the 30 plus factors that they ranked, where were things that were low? And one was in access and the related inequities. That showed to be really important. Another was in the not completely stable nature of our political system. Again, these 2 or 3 things that were low were actually the drivers that took us from a prediction of number 1 performance to a really poor performance.
When you think about, what you're saying, basically like so many things that were already kind of broken and very, very strained before the pandemic were really crushed by a lot of the issues that popped up with the pandemic. I mean, who would have thought we would be in a situation where we saw such significant shortages around PPE, and then complications around polarization, politicization of issues around misinformation, just the extreme amounts of trauma and death that physicians were facing. It's incredible what physicians have done to help this nation recover. How is the AMA at this point kind of turning that around and helping physicians recover from what they've been through over the past 2 years?
Well, what you've alluded to is exactly right. There are a lot of problems that are impinging on physicians. And so there is a laundry list of things that needed to be done. First of all, the support of practices during this extreme time, which required billions of dollars in emergency funding to prevent further Medicare cuts that were really hurting physicians. You know, Medicare reimbursement, although it's increased for hospitals, as an example, over the last 10 years, has remained flat, which is in real terms downward for physicians. We needed, you know, telehealth and telemedicine coverage. We got that, and that was incredibly remarkable. You know, an entrepreneur would say that if I'm going to have a venture, a new company that is really impactful, I want to get a 10x result. Well, from January of 2020 to May of 2020, the increase in utilization of telehealth wasn't 10x, and it wasn't 30x, it was more like 100x. It was really, truly remarkable. And we can't let that slip out of our fingers now. And then combating misinformation. As I mentioned before, you know, a lot of false information that was amplified many times through social media. And there had to be a voice of medicine and science around that. And I think we supplied a strong element of that in our own messaging. You know, one of the things that, in talking to a person who studies communication and science, one of the things that they made to me is, when you're talking about the best practices in health and science, should be done by physicians and scientists. And as soon as the voice behind the podium is a politician, and it doesn't matter what party they're from or whether they're inaccurate or accurate, you've politicized the message. And that's something that we had to fight through as well. And now, after physicians have gone through this heroic event on their part of the last 2 years, it's probably time we think of a recovery plan for American physicians that would, of course, benefit American physicians, but also benefit the patients they care for.
What does a recovery plan for America's physicians look like?
Well, a lot of it deals with support for practices, and also getting rid of administrative tasks that take away that face-to-face time with patients. So a lot of administrative burdens. One is prior authorization. You know, and you see that really in a large, remarkable form right now. A third of American physicians surveyed report a serious negative consequence to patients in their practice due to prior authorization. And basically all physicians recognize the brutal administrative load. And, you know, one form of this is what is called step therapy. So a health plan will say that, you know, we recognize that in the instance of this disease, there are 3 drugs that could be given, and we want them given in this order: A, and only go to B if A fails, and only go to C if B fails. And a lot of that has to do with finances. And so you're on a drug, you're on C, you've gone through A and B, and now it's November, and, you know, time to re-up your plan. And either your employer or your plan changes, and you're told prior authorization, step therapy. You have to go back to these drugs that you know don't work. And then if you look at prior authorization writ large, there's an average physician has something like 30 plus 34 of these a week. It takes that physician, him or her, or people on their staff, basically 2 full days, 16 hours to work through. And most of the time, everything is let go to move forward. So that that is part of the recovery plan. Elements like that really drive physicians crazy, utilize time, and are deleterious to patients, and interfere with that face time that physicians have and they need. We need to keep this extended telehealth effort so that the flexibilities don't go away. That there were some geographic restrictions, for example, prior to the pandemic. And we need to address physician burnout. That's really important, and it's really, as you pointed out, limiting our physicians from thinking about the length of their own careers. And then lastly, things like promoting physician-led teams, making sure the physician voice as leadership of the healthcare team remains as such. So all of these are really important agenda items in a recovery plan for American physicians after they've gone through the ringer. Mention one thing about going through the ringer, and in I think it was April or May of 2020, during the height of the pandemic, initial pandemic in New York City, I talked to a head of a emergency department in a hospital in the Bronx. They had 15 bays in that emergency department, but they had 85 gurneys occupied by patients. So this is the sort of extreme pressure that physicians and other health providers were under over this period of the last couple of years.
It is remarkable when, when I listen to you talk about a legacy, 175-year legacy, and you think about the achievements on throughout that process, but then even more so when we look at it through the lens of the last 2 years, knowing the issues that we stepped into this pandemic with, and what the AMA was able to achieve for physicians, for patients over the last 2 years, particularly around emergency funding, preventing Medicare cuts, securing coverage for telehealth, which expanded so greatly, like you talked about, and then the role in stepping up, like only an organization like this can, to fight misinformation. But I hear your point that we've got a lot of work to do, and this recovery plan for America's physicians, you'll be hearing a lot more about, but key focuses on those obstacles like prior authorization and key issues like Medicare payment, telehealth reimbursement, and physician wellness. So a lot of work to be done in the aftermath of this pandemic to take care of America's doctors. Thank you so much, Dr. Madera, for joining us today. That wraps up today's episode. We'll be back soon with another moving medicine video and podcast. You can find all of them at ama-assn.org/podcasts. Thanks for joining us. Please take care.